but I can't do the jobs of 3 people. I just can't do it. When I see elderly patients waiting for hours in A&E, ambulances queued round the block because they can't get anywhere near the door. Any sense in one of the richest countries in the world.
Many foreign UK nurses are already in panic as UK Prime Minister Keir Starmer announced his plans to abolish the NHS and replace it with another organisation.
Management of the NHS back into democratic control by abolishing the arm's-length body NHS England.
If he succeeds in doing this, many UK nurses are going to go unemployed and won't have what to do again.
I'm a mental health doctor and psychiatrist.
In the NHS?
Absolutely. I mean, the idea that we had the NHS and it's been an absolute disaster. So for him to come along and say that it's really far too little, too late. We've had something like 200,000 nurses, been shortage in nursing places before the cuts to the.
This is going to cause a lot of problems in the health system, especially as the NHS is one of the largest employers. Before we tell you everything, make sure you subscribe to our channel and ring the bell for upcoming updates. In recent days, the announcement by Prime Minister Keir Starmer regarding the potential abolition of NHS England has stirred significant anxiety among healthcare professionals, particularly foreign nurses.
Look, nobody goes into nursing thinking they're going to have an easy ride. You do it because you want to help people. It's as simple as that. But we're at breaking point. Overworked, exhausted, undervalued. Sometimes there's not even time to have something to eat or a toilet break, let alone listen to someone who's lonely or just had a relative pass away.
With plans to replace the NHS with a new organisation under the Department of Health and Social Care, DHSC. The implications for the current health system and its workforce are profound. Delves into the details of Starmer's proposal, the historical context surrounding the NHS, and the potential fallout for nurses and the healthcare system as a whole. Keir Starmer's announcement marks a pivotal moment in UK healthcare policy. He has proposed to bring the NHS back under democratic control.
Management of the NHS back into democratic control by abolishing the arm's-length body NHS England.
A move aimed at cutting what he describes as unnecessary bureaucracy. This shift would dissolve NHS England, which has been operating as an independent body since reforms initiated by the Conservative-led coalition government in 2013. This previous restructuring aimed to minimise political interference in NHS operations. But Starmer's approach signals a desire to reintegrate health oversight within the government framework. The NHS is not just a healthcare provider. It is the largest employer in the UK, with approximately 1.7 million staff members. It serves around 1.7 million patients daily, making it an essential component of public health infrastructure. The NHS operates on an annual budget of around £190 billion, primarily funded through general taxation. The potential reorganisation raises questions about job security for many, especially those in pivotal roles, including foreign nurses, who represent a significant portion of the workforce. As the government moves forward with these plans, one of the most pressing concerns is the potential for widespread unemployment among nurses. Many foreign nurses have already expressed panic over the implications of this announcement. The NHS has long relied on international talent to fill gaps in staffing, particularly in areas where there is a critical shortage of skilled professionals. If the proposed changes lead to significant restructuring or downsizing, many nurses may find themselves without employment. The UK has historically faced challenges in recruiting and retaining healthcare professionals. The NHS's reliance on foreign nurses has been a stopgap measure to address staffing shortages. A sudden upheaval in the structure of the NHS could exacerbate existing issues, leading to a potential exodus of nurses from the workforce. This situation would not only affect the individuals directly involved, but could also have far-reaching consequences for patient care and public health. NHS England was established to provide a level of independence from political influence, allowing for more streamlined decision-making processes. The organisation has played a crucial role in setting healthcare standards, managing budgets, and overseeing the delivery of services across the nation. The proposed shift back to the DHSC suggests a return to a more centralised model, reminiscent of practices seen in many other countries. However, the centralisation of healthcare governance is not without its challenges. Many European nations benefit from a national Ministry of Health that sets broad policy directions while allowing regional and local authorities to implement strategies tailored to their specific needs. This decentralised approach often leads to more responsive and adaptable healthcare systems. Starmer's proposal to reverse the previous reforms raises critical questions. Will this new structure be able to effectively address the unique needs of different regions? How will the government ensure that local health authorities have the autonomy required to respond to the specific challenges they face? Transitioning from NHS England to a new organisational structure under the DHSC presents numerous risks. One of the primary concerns is that the focus on reorganisation could detract from the urgent need to improve patient care. NHS managers may find themselves preoccupied with handling the complexities of this transition rather than concentrating on enhancing services for patients. The government has a roadmap laid out by Lord Darcy, who provided a comprehensive diagnosis of the NHS's issues. Prioritising which problems to tackle first will be crucial. While the government has made some strides with planning guidance, the success of these reforms hinges on how well the transition is managed. For example, ensuring that important roles are effectively transferred to the DHSC and local health authorities will be essential for maintaining service continuity. Moreover, the government must remain accountable to the public, who are increasingly impatient for improvements in NHS services. If the reorganisation leads to further delays or disruptions in care, public trust in the government's ability to manage the healthcare system could diminish. The potential implications of abolishing NHS England extend beyond job security for nurses. They directly affect patient care. The NHS has been a cornerstone of British society, providing accessible healthcare services to all citizens, regardless of their financial situation. Any significant disruption to this system could lead to gaps in service delivery, longer wait times, and a decline in the quality of care. Patients may also experience increased anxiety as they navigate an uncertain healthcare landscape. The fear of losing access to their healthcare providers or experiencing delays in treatment could deter individuals from seeking necessary medical attention. This could have cascading effects on public health, leading to worsening health outcomes for the population. Starmer's announcement comes amidst a backdrop of political turmoil and public scrutiny of the government's handling of the NHS. The NHS has been a focal point of political debate, with many citizens expressing dissatisfaction with the current state of healthcare services. By proposing a significant overhaul of the system, Starmer aims to address these public concerns. But the risks associated with such a radical change cannot be overlooked. The political landscape in the UK is fraught with challenges, and healthcare remains a critical issue for voters. The government's ability to successfully implement these changes will likely influence public opinion and electoral outcomes in the future. The stakes are high, and the pressure to deliver tangible improvements in healthcare services is mounting. As the UK navigates this complex transition, it is vital that the government proceeds with caution. The potential abolition of NHS England could have far-reaching implications for nurses, patients, and the healthcare system as a whole. Collaboration between government officials, healthcare professionals, and the public will be essential in ensuring that any changes are made thoughtfully and effectively. For foreign nurses and healthcare workers, the uncertainty surrounding their employment and the future of the NHS is understandably alarming. The government must engage in open dialogue with these professionals to address their concerns and provide assurances regarding job security and the continuity of care. Ultimately, the success of any restructuring efforts will depend on a balanced approach that prioritises both the needs of healthcare professionals and the well-being of patients. The NHS has long been a symbol of national pride and public service in the UK. Safeguarding its integrity during this transitional period should be the top priority. The future of healthcare in the UK hangs in the balance, and the path forward requires careful deliberation, transparency, and a commitment to improving health outcomes for all.